Welcome to the podcast that puts a finger on the pulse of medicine and technology. On this show, you'll hear from investors, industry executives, and healthcare providers on the science and business of medicine. I'm your host, Omar Khateeb, and this is the State of MedTech. Hey everybody, welcome back to the show. We got a great guest this week with a very interesting backstory to how we recorded this episode. So my guest is Scott Huennekens. You've probably know him as one of the more well-known and well-respected medtech board members and investors. But believe it or not, this was the very first recorded episode of the State of MedTech. That's right, the very first recorded episode. This was recorded back literally the very first week of January, right probably around the time I had no idea what I would be doing. I knew that I wanted to be an entrepreneur, but this is before I really had a business model or anything set up. And I said, it never hurts to have a podcast. So I said, okay, I'll call it the State of MedTech, and I'll interview one of the biggest names that I can think of now, Scott. And so Scott obliged and got on and carved out some time from his busy schedule in the new year just to do that. And the reason why I mentioned that is that it really highlights his character and respect for entrepreneurs. And I want to share a little bit about how I, learned about Scott, his background, but also I have some bonuses in this episode. That's right, some great bonuses. This is the first time I'm doing this on this episode. So bonus number one, as many of you know, we have this podcast powered by our partners over at CMFI, meaning that for the majority of our podcasts, we add a CME credit to that. That's right. If you're a physician, nurse, physician's assistant, clinician, anything that requires continuing medical education, you can unlock an AMA PRA Category 1 credit by listening to this episode and then clicking the link in the show notes below and then writing a few sentences of what you learned. Now, if you're a medtech company and you want to learn about how I can work with you to help make one of your events, even your demo or maybe one of your podcasts, CME eligible, go ahead and shoot me a message on LinkedIn or shoot me an email. You know where to find me online, and I'd love to work with you. Now, the second part, which is the real surprise, is that while this is an amazing episode, you're going to get a lot of pearls. There's a reason why I wanted to add a CME credit to this. And the reason why is that Scott has just a remarkable story in terms of how hard his life was growing up, the triumphs and obstacles that he had to work through. And then I got to tell you, I've sat in on a lot of, keynotes from entrepreneurs and board members that, to be honest with you, just were the usual run-of-the-mill keynotes, but Scott's keynote at LSI 2021 was one of my favorites. It's so good. The slide deck is fantastic, and you actually walk away learning a lot. Whether you're a CEO or a founder raising money or an aspiring entrepreneur, I really recommend you watch it. And so, because I am good friends with Scott Mantel over at LSI, and I don't think he would mind me doing this, I went ahead and downloaded the video online, and I'm going to upload it right here in this episode. So that way, for those of you who are driving and maybe watching this at home, you don't have to click over and find the video online. So the first part of this podcast, you'll be hearing from me and Scott in our episode. And then after that's done, we'll go straight into his keynote from LSI 2021, which is fantastic. Again, I can't speak highly enough about LSI. One of the best medtech investor conferences on planet Earth. I don't even go, sorry JP Morgan, but I don't even go to the JP Morgan Healthcare Conference anymore. I just look forward to LSI every year. So be sure to listen to that. So now, without further ado, let me give you a little bit of background on our guest today. So Scott is a successful medtech CEO, chairperson, board member, entrepreneur, and investor, and he's been involved in one of those roles in the 20 plus startup growth public companies with market evaluations that have totaled a little over 20 billion, but more importantly, over 20 million patients have benefited from the therapies and diagnostics of these companies, including 8 IPOs. If you go back before his illustrious career, he grew up here in Southern California and graduated magna cum laude with a BS in Business Administration from the University of Southern California in 1986, and then earned an MBA from Harvard Business School in 1991. His past affiliations include 12 other public or VC-funded medtech and biotech company boards, of which 9 have had significant exits, including chairperson of EndoChoice, which was acquired by Boston Scientific. He was a chairperson of Sonendo, board member of Vicarious Surgery, which was IPO'd in 2021, and board member and advisor to Digital Surgery and Touch Surgery, which was acquired by Medtronic. Scott's also been awarded EY's Entrepreneur of the Year Award in 2010 and was recognized by Goldman Sachs in 2016, 17, and 18 as one of the 100 most intriguing entrepreneurs at his annual Builders and Innovators Conference. Now, in my opinion, the thing that really got Scott recognized and put on the map was when he led Volcano Corporation, which on the NASDAQ at the time, it was VOLC, if you remember it, which is a leader in minimally invasive therapy guidance in interventional cardiology, as its first and only president and CEO, from startup in 2002 to its IPO in 2006, and then sale to Philips in 2015. Volcano's 2014 revenue was over $400 million, and its market cap peaked at nearly $2 billion. Now, just to kind of give you a breadth of the variety of companies that Scott is involved with as a chairperson or board member, Hyperfine, which is the world's first mobile MRI or point-of-care MRI, Acutus Medical, Proximie, Vicarious Surgical, Nuvasive, Wonder Medical, Q Apple, the list just goes on. And so this is a gentleman who has the experience and leadership at so many different levels, and so he's highly sought after as a board member and an investor. As you can tell, there's a long list. But I first got to discover Scott when he was the president and CEO of Verb Surgical in early 2019. Verb was Google and Johnson & Johnson's surgical robotics and digital surgery platform startup that was focused on revolutionizing the future of surgery, and J&J acquired it back in 2019. Scott joined as employee number 1. And the way I got on Scott's radar was, at the time, I was using LinkedIn to write about marketing and persuasion and robotics, and I really wanted to get the attention of the people over at Verb. And so one day when I was in Cabo, Mexico, of all places, on the beach, I just had a really deep reflection about the future of surgery and robotics, and I sat down for like 7 hours and wrote this article called Democratizing Surgery, Part 1. And I published it on a Thursday, which many of you who use LinkedIn know you don't usually publish an article late on Thursday, but I did. The next Friday, I woke up and I got so many emails saying, hey, your article's going viral over at Verb and online. It's made it to the CEO's desk multiple times. So-and-so has it. And so that's how he first found out about me. And, we never got to meet until the, I believe, JP Morgan Healthcare Conference a few years later. The last thing I'll say about Scott before we jump into this episode is that I'll never forget the first time that we met and what he told me. And the reason why I say this is because for those of you who are listening to this who might be a CEO or an investor, somebody who's in a very high leadership position, you never know the few words that you tell somebody, what kind of impact that'll have on them, what it'll activate. So when I was at JP Morgan Healthcare, I saw Scott, and I walked up to him and introduced myself, and he, of course, immediately recognized who I was just from following me on LinkedIn and my articles, and was very happy to see me and complimented me. And I don't remember who was with him, but somebody was, was with him, or at least came up, and he turned to this person and said, this is the kind of person who's going to change our industry. And he said that with such sincerity. He was so genuine about it. Like, I never forgot that, because I was a young guy, and I was just sort of moved to Silicon Valley and everything. And those are the few times where I remembered somebody saying something to me that really inspired me to go on my own entrepreneurial journey. And fortunately now that is exactly what I'm doing, which is focusing on how I'm going to change the medtech industry in terms of how we sell and market. I've burned the boats, whether it's 5, 10, or 15 years. I'm going to make that happen. And I'm going to do it with a small tribe of people who are like-minded visionaries. So, with that being said, here's my episode with Scott Huennekens, and shortly after that, you'll get to enjoy his keynote from LSI 2021. If you're using Spotify or YouTube, you can watch the keynote on either one of those, and I highly recommend you do, because there are some fantastic slides that you're not going to want to miss. So, that being said, here's the episode. All right, and we are rolling. You ready?
I'm ready.
This is going to be a lot of fun. Hey, everyone. Omar and Khateeb, your host and head of state for the State of MedTech. I'm joined by the great, the powerful, the legendary Scott Huennekens. Scott, thank you so much for joining us. It's such a pleasure. What a great way for me to start the year by having you on the podcast. How are you doing today?
Doing awesome. And I was just going to say the same thing. It's fun to be able to start the new year talking to you, Omar, and thanks for doing this. It's terrific to share information to the medtech industry.
Absolutely. Absolutely. I mean, the State of MedTech, a big focus of the content is emerging technologies, professional development. But, I think selfishly, one of the reasons why I started this is that I think, I can speak for myself and a lot of young medtech professionals. We join organizations and try and move up to the top, because at those once a time a year events, like let's say a sales conference or an industry show, we want to meet leaders like yourself just to listen to stories from the trenches, stories about the future, and get advice. And so, this podcast is really going to be one of those things that live on for such a long time. I was able to do this with my late mentor, Christopher Sells, and thousands of sales professionals continue to benefit from that podcast long after he had passed. And I think that these are the kind of conversations we really look forward to. So a lot to cover, but for those who are, let's say, new to the industry and perhaps are familiar with you, but don't know a little bit of your backstory, can you give us a little bit of your orange story about, where you're from, where you grew up, and where you got to today?
Yeah, I don't know how much detail you want to get into, but
you can take this in any direction you want.
Yeah, so my background, we were just talking before this. I grew up in Riverside, and I know you just relocated to Temecula, so you're sort of one of my Inland Empire people now. But
that's right.
Grew up there, and single parent family, tougher kind of upbringing and neighborhood, and had to pay for my own way to college, and did community college, and then got a full scholarship to USC, and had a goal of going to the Harvard Business School, which I did because I wanted to be an entrepreneur, and I wanted to build companies and create value and jobs and solutions. And coming out of there, it was at that point in time, 1991. It was I don't know if it even has a term, but it was a recession, which was then later exceeded by the Great Recession. But it was the beginning days of a lot of the tech industry, and I was both in medtech as well as other technology. And so I wanted to go to work in one of those spaces where there's fast-moving technology, opportunities to change markets, disrupt things, because that's kind of a fit with my personality. I don't like accepting the status quo. I like and want to make things better, cheaper, faster, all those kind of parameters. So that's when I got into the medical device industry. I was very fortunate to get a job as an assistant to a president of a company called Berger Medical Systems. It was the very beginning of minimally invasive surgery, in the abdomen. And this guy, Eddie Joe Reddick, had just taken out gallbladders for the first time. I graduated from business school, and 2 weeks later, I was teaching physicians how to take gallbladders out in Hyatt Regency grand ballrooms, which my wife thought was entirely humorous since my brother-in-law just graduated from med school and I graduated from business school. And here I was, doing this. But, it was this really, it got me addicted to the medical device industry to say, hey, here's a patient who had to go in the hospital for 2 weeks to have this surgery and open their whole abdomen. And now with the advent of, minimally invasive surgeries and cameras and instruments that could go through ports, we could do this minimally invasive surgery, and patients could be home in 2 days, and quick recoveries and better outcomes and all of those things. And so I progressed from there. I went to work for Edwards, which was part of Baxter at the time.
That's interesting history that people don't know about.
Yeah, so my first boss, he's heard me tell the story a few times, was Mike Masalem. So Mike hired me, who's the current CEO of Edwards. And those of you who are not familiar with Edwards spun out of Baxter with a market cap of about $700 million. And today its market cap's, whatever it is, 17, 18 years later, $70 billion. So that team at Edwards and everyone who's been involved, it's been a tremendous accomplishment. And it ties right into what I was talking about. They basically progressed valve surgery from that open surgery into minimally invasive surgery with TAVR and everything else they've done. And they do a great job in monitoring as well as open and closed valve surgeries and valve repairs. And so I was there for 5 years, was a director of marketing, a business unit leader, a VP of sales and marketing in the Novacor division, which was the LVADs. And it was kind of what I jokingly call my PhD and my introduction to cardiology as well. And then left there, and because as I mentioned, I wanted to do startups and wanted to build companies. And so moved to San Diego and joined as the number 2 a company called Digirad, which was making a next generation gamma camera for nuclear medicine. So basically going from vacuum tubes to solid state. And this is, I think, a trend you'll see throughout my career. It's like looking for the old technology and how we could make it smaller, cheaper, faster, better. And so going from, basically like those, big vacuum tube TVs to flat screen TVs, essentially what we were going to do at Digirad. And like most startups, another one of my favorite phrases are, there are no bumps in the road, that is the road. And the technology had a lot of challenges along the way to go from vacuum tubes to solid state, as well as market challenges. 9/11 happened when we were trying to take the company public, had to regroup after that. The company eventually did go public, and we actually focused it on the application of nuclear cardiology, where it became kind of a standard of care for physician offices to do nuclear imaging in their offices. So again, it was, these themes of going from, older technology vacuum tube to solid state, which then enabled changes in business models, because now we could go from, 1,000-pound systems that had to be in hospitals to a smaller system or unit that could now be in a physician's office. So we could change where care was delivered and make it simpler, faster, easier for patients as well. And then, a lot of these cardiologists didn't have nuclear cardiology capabilities. So we actually created a way for them to upload files. Now the internet was coming, so then they could have overreading. So again, we're leveraging technology to deliver care in different ways than were possible before. And so then after Digirad, I went to Volcano. Volcano was a startup company to try and understand how plaques progressed in your heart. Our goal was to eliminate heart attacks. And so we had numerous technologies, near-infrared spectroscopy, thermography, and then advanced ways of doing intravascular ultrasound to look at these plaques and the like. But again, like I said, with startups, technologies don't always cooperate. Clinical results don't always cooperate, and you have to adapt and change. And I look at success as less about, hey, was your original idea successful, but did you make the business successful, and how did you adapt and change to the circumstances of the markets, the technology, et cetera. So we actually had to give up on our vision of vulnerable plaque, and we moved on to, hey, let's understand plaques from both an anatomical and a physiologic standpoint to optimize stenting, where we'd moved from, again, back to my Baxter Edwards days when we were doing surgery to fix people's hearts and do bypass. Now, minimally invasive surgery had come along so that we could do angioplasty with balloons, then bare metal stents, and then eventually drug-eluting stents. So at the beginning days of Volcano, we were still in that bare metal stent era. So it was like, where should we stent? What size stent? How should we expand the stent? And we could provide all that information with intravascular ultrasound to hopefully reduce what was called restenosis at the time and the tissue growth and the like. And then we had the benefit of drug-eluting stents that came along, which helped deal with restenosis, but then there were other problems with stent thrombosis, and with IVUS, we could help limit that. We also had FFR, which was fractional flow reserve, to kind of measure pressure gradients. That was then added to the equation. Then we went from coronaries to peripherals and just kept adapting and changing and finding indications for the technology. But again, then it was back to, hey, how can I apply technology? When we started at Volcano, Boston Scientific was the 800-pound gorilla. We bought Endosonics, put it together with some of our technology. So we basically took IVUS from being black and white to colorizing it with what we call virtual histology. We also took the system that had 26 boards and weighed 800 pounds, and we made it something that had 3 boards and weighed 20 pounds and could be integrated in every single cath lab. So it wasn't just about the clinical data, it was about eliminating the friction to use. So it was, hey, instead of that big, 1970s stereo with 3-foot speakers blasting Led Zeppelin, we were creating the 1980s, new wave music, iPod with music. And so, again, making it so that you could take technology, adapt it, make it more accessible, frictionless. Instead of something taking 40 minutes, it could take 5 minutes to get the information, automating all the processes for segmentation, border sizing, and the like, so that we had integrated systems. So instead of having to, for example, hook up, your boom box and line up all of your antennas, your car just came with a radio with satellite already kind of built in for you to use. So, you're going to use N with GPS and everything else. So we use those kinds of analogies and trying to think about from the tech industry how we could move things forward to improve care and make technology simpler and easier. And I think that's often a problem where, people look for technology to be, the solution, and it can be overcomplicated. And IVUS, at the time we got into it, was overcomplicated with 86 buttons and all this stuff. We moved it to 5 buttons, integrated. And I always love that Clay Christensen, book, where in the Innovator's Dilemma, but also just how we talked about what are you hiring your product to do? And what we were hiring the product to do was, hey, should I stent or not stent? Where should I stent and what size stent? And if you can tell me all that in 3 or 4 minutes, that's better than having to deal with 86 buttons and rolling an 800-pound system. So, we started up, continued with Boston Scientific. 10 years later, we were the market leaders in IVUS and FFR, and grew.
This is all at Volcano, correct?
All at Volcano, yeah, and grew to about $500 million in revenue and a market cap of a couple of $1 billion, and sold to Philips, which it integrates beautifully into their solutions with their cath labs. And
nice.
This is getting long-winded.
And you guys sold for
my career, but,
no. No. This is exactly. I'll tell you. This is what people want to hear. But I do want to go back to something you had touched on.
A lot of different medical device companies across cardiology. Then worked on the Google campus. for 4 years doing Verb Surgical, which was the next generation robot, taking things to the next level with a connected platform to the cloud. And again, how can technology create this next generation? So you've heard me often say things like, oh, that was surgery 1.0 was open surgery, 2.0 was minimally invasive, 3.0 was robotic, and now we were going to create digital surgery 4.0 with connected platforms and AI and the like. If you go back, kind of, surgery minimally surgery 1.0 would have been Edwards open heart surgery, 2.0 would have been balloon angioplasty, 3.0 drug-eluting stents, 4.0 was Volcano with precision-guided therapy, and always looking for how we can continue to improve things along the way with either the technology or where we could do something if it was a cheaper, faster, easier location to be able to do something, because that all leads to democratizing care. And our big vision at Verb was we have 7.5 billion people on Earth, and only about 20% of them had access to surgery. So how do we get it so that the other 80% have access to surgery? A Volcano and minimally invasive angioplasty is very similar. It takes 86 people to do a heart surgery. So if you're a country and you're saying, hey, I can treat this many people and it costs this much, $45,000, 86 people to do open heart surgery, or angioplasty takes basically 7 trained people and I can do it for $3,000, you can treat 12 times more people with heart disease that need that surgery, as an example.
That makes a lot of sense. And, I think for a lot of people, they became a lot more familiar with you. I think, Volcano was like one of your great successes in your career. Again, getting to 400 or 500 million in revenue, selling to flows for 1.2 billion. I think when Verb came around, LinkedIn was a lot more active. And so a lot of people knew and followed you in terms of the great work that was done at Verb. And of course, now that's been integrated with Johnson & Johnson and Oris. But something I want to go back to on Volcano, and again, what's interesting, maybe not so coincidentally, but later this week, I'm interviewing the great and legendary Jeffrey Morse, who a lot of people on this podcast know of because I always reference his book Crossing the Chasm. He's written a lot of books since then. But over at Volcano, again, like when you introduce new technology, even if it is clinically better, if it is ergonomically better, all these things, technology adoption doesn't really happen. And so I feel that, when the technology evolved at Volcano, you made some very specific decisions as a CEO to drive that adoption. What was the lever that you pulled that you think really got things going on adoption?
Yeah, and it's a great question, and it's often it's figuring out that equation, and hopefully that equation or that algorithm is simpler rather than more complex. And with Volcano and often a lot of these technologies, there are no silver bullets, and it takes multiple solutions to create a total solution. So for us at Volcano, I mentioned when you got to roll in an 800-pound system, plug it in, boot it up, you got to have an expert in reading the IVUS image, you got to prep a catheter, and that takes time for putting the fluid in and doing all of that. That's all friction. You can have data that shows the procedure and your outcomes will be 30 or 40% better. But if it takes 40, 45 minutes more, that adds, thousands of dollars for your OR time, for the catheter. There's no additional reimbursement because it's under a DRG code. You're going to be limited in the use of the product. So it's looking at all those elements, product elements. Well, we need the product to be integrated. We need there to be automatic software to read the borders. We need a catheter that does not require, fluid preparation. Just a phased array catheter, pull it out, go. And it needs, so those are the products. We need more clinical data to get to level 1, level 2 evidence to support the use of the product and from an outcome study. So you got to invest in the clinical studies that go along the way. And then you got to have your distribution and your sales channel and people who are trained and all the other training programs for training physicians nurses, and everyone else to support it as well. So for us at Volcano, it was, and it's often the case, I use the analogy, it doesn't matter which business, it's, hey, you got to find a killer app. And for us, the killer app to start with was left main. So left main disease, the widowmaker, the critical, artery there. We could justify, you need to use IVUS for all of your left main cases. Then, so we got physicians using it and training it. Then you could say, okay, now here's your data for bifurcation. So now here's your for CTOs, here's your, and you build out that solution set. It was the same thing with FFR. FFR, you had to do an adenosine injection, you had to do these adjustments. The whole thing was just complicated, difficult to repeat for clinicians. Finally, to move things along, we developed what was called IFR with Justin Davies, who had invented it from Imperial College, which meant you could eliminate having to do the adenosine injection. You get these automatic readings, automatic calculation. It's basically a red light, green light on your pressure gradient and whether you should stent or not. We automated it so that, when you did your IVUS pullbacks or FFRs, it overlaid on your angiogram in 3 dimensions. We did all these things to eliminate friction and get you the information that you wanted. But that took time, and it built over a period of 5 to 7 years.
What about those earlier times, though? Because I feel like that's the part, which you say, makes complete sense in terms of doing things correctly, right? Gathering the data, trying to automate things, reducing time and everything. But at the very beginning, the problem with all technology is that the baby's always going to be ugly. And so, but when the baby's ugly, it's so important to find, again, like referencing Jeffrey Moore's work, those, not even early adopters, way before that, those people who are visionary, who, there's no data, there's no studies, no nothing, but they look at the technology and they can look into the future and say, yeah, I could see the vision. Like they can see with their eyes closed. How did you find those people? And I know that a lot has changed, because back when you did this, was back in the 2000s when social media, internet wasn't used as much. Things have become a lot more easier these days. But back then, how did you find these people, and what characteristics did you use to identify them?
Yeah, we were very fortunate in interventional cardiology, where you had the likes of Marty Leon, Greg Stone, the Barry Rutherfords, Paul Pierstings, these visionary guys in the U.S. Same thing with the Patrick Soroises and Marcos and the like in Europe, and the Suzukis and the like in Japan. So in Kato, we were, so it was clear these are they were a neat group. They weren't just these kind of guys like to protect their domain and be the leaders in it. They wanted to advance things to the next level, and and these
are all cardiologists,
all interventional cardiologists who anyway, you get those 10 people together, and you say, what's the vision of interventional cardiology, and what do we need to go from being able to treat this population to this population of people? How do we improve the outcomes? What do we need? And we worked together with them, as well as we partnered with the likes of Abbott and J&J, who made stents, and said, and we got everybody to agree on what the future.
And you're stent agnostic, I would imagine. The platform is stent agnostic.
Got it. Competing with Boston Scientific, we didn't care if it was a Boston stent or.
Do you feel?
So anyway, do
you feel like that?
You get them bought into that vision of this is the future, and you name it. And I think it's always really important to name that future state.
Interesting.
To do it. So for us, it was like.
Why is that important? Hey, we're going to take a quick commercial break. If you're in medical sales, you don't want to skip this. So if you are a sales rep that's struggling to grow pipeline and hit quota, you're going to want to listen to this. Or are you a sales leader? Maybe you're frustrated because your team just can't seem to get any traction at all, and you're at the end of the line. You don't know what to do. So if that's the case, listen closely. I'm going to share a secret to not only solving this problem, but how you could get results at a scale you never thought was possible. So during the pandemic, I was in the exact same position. I was just like you. I was at a medtech company. We were selling capital equipment. we had a lot of problems getting access to hospitals. And, we're a small company. We had just ended our partnership with the world's largest privately held med device company. But the problem was that we only had 4 salespeople, and we were also running out of money. And then the hospital shut down right in April because of COVID. This really was the kiss of death. But with the support of my CEO at the time, I was allowed to try my digital medical sales strategy, right? And so essentially for about 30 minutes a day, I was the head of marketing back then. 30 minutes a day, I essentially used LinkedIn and a few other digital channels and strategies to try and get traction. So what were the results? In 60 days, that's right, that's only 2 months, I was able to put 35 deals in the pipeline of a variety of different hospitals. Big hospitals such as University of Kansas or UCSF or Cleveland Clinic, right, and smaller regional hospitals, HCA facilities, etc. And this was done again while I was still managing the marketing department. So you can only imagine what my results could have been if I focused on that 100%, right? So what exactly did I do? Well, I knew that physicians and hospital administrators were using channels such as LinkedIn. And so I went to the channels that they were already on, found ways to connect with them, engage them, and then through email, messenger, and a few other channels, I was able to get their attention. I was able to persuade them into virtual demos and then move them forward, right? The results were remarkable. So since then, I've started actually my own online training program called the Medical Sales Network Effects Program. It's an online course, and the results that people are getting are really amazing. And I just had to share a couple. So Gaida, who works with spine surgeons, made this post and said, "Hey guys, wanted to share a big win for me this past weekend. I went to a networking event not knowing who I was going to meet. To my surprise, I was approached by a spine surgeon who's been watching my content on LinkedIn and asked if I could show him my portfolio. I have a meeting with him next week. I'm really excited, and I can't believe I'm getting these results. Thanks to Omar and the Medical Sales Network Effects Program, I've been motivated to really stay consistent in terms of putting out content and using LinkedIn." Another person, so for those of you who know the MAD device rep, the MAD device rep is actually a capital sales rep, right? So the MAD device rep shares this great story where he says, "Hey guys, wanted to share this win from earlier in the week. I had a meeting with a surgeon to discuss a new complex product and was reminded about the power of using LinkedIn in the conversation. I referenced some LinkedIn posts related to this product category from several well-known surgeons during the conversation, and this got the surgeon's attention. I was instantly able to build more credibility for both myself and the product using the information from this national peer group. Turns out, the surgeon I was trying to sell to follows those same surgeons on LinkedIn and couldn't believe that I did too. I now have a trial on the books along with more trust from that surgeon. These tactics I learned from the Medical Sales Network Effects Program work just as well in person as they do on LinkedIn." And those, my friends, are just 2 of many great testimonials, and I want you to be the next one. So if you're interested to learn more for yourself as a salesperson, or maybe you're a sales leader looking to level up your team, check the show notes below for a link to book time with me for a quick consult and to learn how my program can help you persuade at scale and drive product adoption in a way you've never seen before. So with that being said, let's get back to the episode.
Because people like to see something and name it and know it, then they have a target to go on or triangulate and even adapt off of. So robotic surgery, it's a name. It's like robotic surgery, digital surgery is a different category. So, there's another great book, The 22 Immutable Laws of Marketing. And I thought one of the
Aureus is the man.
If you can't be first in a category, create a new category. And part of
law number 1, 100%.
Yeah, and the new category is how you advance things to the next level. You're not going to be the robotic surgery company. That's intuitive. But you can be the digital surgery company. You're not going to be the opposite.
Absolutely.
That's Boston. But you can be the precision guided therapy company, because that involves IVUS, FFR, angiograms, co-registration, peripheral and coronary applications. So we defined that. And then we bought the thought leaders to support it, the clinical data, the product vision to do it. And people believed that we were going to do it. And so having a name to it creates a belief and a support and a tribe. And it's important to have that tribe who believes that then we're welcome to have everybody join the tribe and the bandwagon.
And it's something, and it's something different too.
You go from that, like the old analogy of you go from, the village to the town, to the city, to the country, but you don't go, from the village, to the country, overnight. You got to build. And that's where, we built the product introductions, the clinical data, so that you build the access across the board to go from being a small village of people who have a vision of that future country along the way.
How important do you think that is? Because this is a topic that I've really kind of based a lot of my career on, which is one is technology adoption, the other one is category creation, which is not trying to do something that's better, but doing something that's new and different. And that's a really important, I would say, marketing and market development event to signal that something new and different is there to bring those early adopters out. Do you feel like that's one area, at least I do, I feel like that's one area a lot of companies, medtech or not, skip over and they don't do. Do you feel the same way?
So what did you mean by not necessarily better? Did you say that?
Yeah. So I think that a lot of people, when they come out with a new technology, they aim immediately at, this is how this is better. And I think better is a byproduct of doing something new and different. The moment that you say that something is better, and that's the first thing you go to from a marketing and sales standpoint, you've given somebody an opportunity to compare. And then, you never win the comparison game versus doing something new and different. So if you look at surgical robotics, let's say intuitive, that is technically better than doing, freehand manual surgery.
What you're saying is,
right?
is right in line with innovator's dilemma, right? So the first version of a product may not be better, but it has a trajectory when
exactly.
it's developed at scale and over time to eventually be better. But, was balloon angioplasty better than bypass surgery at the beginning? No, not at all. But it allowed you to go from balloons to stents to drug-eluting stents, which end up being better from a cost, access, totality of patients that can be treated. Outcomes probably, finally have caught up to be equal, but it was better across those other categories. But it took time to get there, and it was easier for more people to be trained on it and implement it and get it to scale. So I don't want to get involved in things that don't offer the prospect of being better, that just offer being different.
Of course,
they got to have the prospect of being
absolutely
better, and hopefully better across outcomes, cost, access, and location of also. We could go to a lower cost, more democratized location in order to deliver the care. The more of those that your technology or business checks off, the more optionality you have for success. If you only have one and that goes away, your business doesn't do well. If you got 4 to play for and you get 3, you're going to do well. So I try and look for things with big markets, can address all 4 of those ways to be better than the prior generation.
Got it. When you mention a killer app, what does that look like? Is it a killer app is that something that a company can start with, or is it something that they have, sort of a future roadmap to build towards? Because you had mentioned having a killer app. What does that look like?
Yeah, a killer app is to me is something that will have early adoption, and you can get across that chasm, and that will allow you to live into the dream of adding, all the additional apps or capabilities that you see for that vision or future that you just mentioned earlier. So if you're Google, what do you have to win at? You have to win at search. Then search, you can add in Gmail, you can add in Google Photos, you can add in YouTube, you can add all these apps. So when I was there on Google, and I remember having lunch one day with Sergey Brin, and I was talking about talking to him about, God, what an incredible vision. You had this, and then add these things out that were complementary and synergistic and built upon each other. And he said, Scott, it didn't happen that way at all. It was, we had to win in search. Then we just said, hey, what are all the other potential things? We let them tell us which apps, were most synergistic and created the most value. So similarly, we felt like at Volcano, we had to win, and left Maine to start with, so that there was a reason for that IVUS to be built into every cath lab. Then we built out and had an open platform that ended up having, 20 plus apps on it, meaning rotational IVUS, phased array IVUS, pressure, flow, co-registration with angiograms, keep going down, software augmentation things. But you had to have one to kind of get you going. So, Hyperfine, we went public a week and a half ago. Where I'm
Congratulations.
And we're portable MRI. Well, there's lots of things that we can use portable MRI for. Or do we?
And that's a category. I would say that's a new category itself. That's a very exciting one.
Now, you can be a mile wide and an inch deep, across all these things. But we said is, what's the killer app to get started with? That's stroke. That's the brain. That's the place to go first.
Super important.
And then we go from there as we move forward.
And I want to point that out to listeners, because again, a lot of founders listen to the show. I think that this happens a lot. I see it very often in SaaS, but especially in med device, where you come up with a device. It's not easy nor cheap. I mean, SaaS, you can make a change overnight and that's done. But in med device, you have to go through the FDA. There's so much money that's involved. So when you finally go to market, there's this temptation that, we could sell to everybody. And I feel like the most successful company, even Intuitive at some point, they said, forget the heart, forget everything. We're going to focus on radical prostatectomy. How important is it for founders and startups to say, we need to pick a beachhead, we need to pick something and focus on it and own it, and then we can expand adjacently? Is that the right way of thinking about it?
I think it's critically important. It takes a bit of exploring in order to do that. Hopefully you hit it early so you don't burn through a lot of capital trying to find it as you go. Now, with that said, you look at Edwards. So Edwards starts with high-risk older patients for TAVR. Then they move into lower and lower risk patients over time to give themselves the greatest probability of success as we move forward here. So yes, I mean, each business, especially when you're starting up, you're raising your Series B, your Series C, you need to focus in on a couple of things to begin with and then build off of that as you go forward.
With Hyperfine, and I know, so I'm going to be having Dave Scott, the CEO, on the show soon as well. With Hyperfine, when you guys chose, you mentioned so for mobile MRI, you got, obviously you can go into a lot of spaces. You chose, was it cardiology is what I heard earlier?
No, stroke primarily.
Stroke. How did you end up deciding stroke? Like, why, of all the things that you can do mobile MRI with, why there?
Yeah, so it's multifactorial. You look across a number of different factors. Product configuration initially, what's optimized for it. Clinical data that would be required to do. What's reimbursement like? What are the physicians like relative to early adoption of technologies? And like certain things would have required the product to be adapted and cost more to develop. They would have taken more clinical data for acceptance or been more challenging for the technology. Soft tissue of like doing a knee exam for an MRI, for example, more challenging. Configuration of product more challenging. So whatever those factors are for your business, amount of capital required, time, it's multifactorial.
Got it. Now I want to pivot a little bit, and again, keeping an eye on time for you. So I'm going to try and pack in as much as I can here for our audience. But at least when I look at your career trajectory, you've had such an illustrious career. Really interesting. Again, what I love is very, very humble, tough beginnings. and you made it to this point, and you've had such tremendous impact in your career. And of course, in my opinion, more importantly, the millions of patients you've helped these companies impact. But I think a lot of this, there were a lot of really interesting challenges I feel that you faced at Verb. And I say that only because surgical robotics, speaking from experience, is very, very difficult. You're dealing with two very large companies, being Google and J&J at the time. As the first CEO and leader back then, like, what were some things that you learned yourself and main takeaways that you took from your time there?
Yeah, it was a great experience working on the Google campus, working with great teams at both J&J and Google. Anytime you do these joint ventures, you realize you have to have, and it applies to most other businesses as well, you have to have strong governance and agreed upon governance, meaning, hey, we're not Google, we're not J&J, we're Verb. What do both investors or both companies feel comfortable with relative to culture, compensation philosophies, the product itself? Because Google may have one view and J&J may have a different view. How are we going to make decisions? We also need to be one team, not three teams, Google, J&J, and Verb. So we set a lot of that up front, up for success. So I always said from day one, there's no pointing fingers, that's Google's fault, or that's J&J's fault, or that's Verb's fault.
Extreme ownership, essentially.
Yeah, anyone is caught pointing your finger, press it up. We're one team. And that just stuck. And so every picture we would take, we'd all hold up, we're one team.
Now I know. I was wondering what the one, I thought it was like, we're number one. Okay, got it.
We're one team. And teams where people point their fingers and all that, it's not a good thing. It doesn't mean that we shouldn't challenge each other. We're absolutely going to challenge each other. We're going to follow lean methodology and plan, do, check, adjust. We're going to have a transparent culture, and we defined what that was. We took things from Google's 10 things. We took things from J&J's credo. It's kind of like they were our parents and we were the child, and said, this is how we're going to have an I am Verb culture that people that are on the Google and J&J teams have to fit into and run with. So, I think we did a really, really good job at those things. Joint ventures are difficult because it's a build to buy, for the intention from the beginning for J&J to buy the entity, which is what transpired. And then that company then now owns it. They get to run it and make product decisions and clinical decisions and everything else however they would like. It's no longer a Verb team. It's your J&J, which is fine. And that's what happens. When Volcano sells to Philips, it's no longer Volcano with Volcano's culture. It's Philips. And so,
got it.
My fingers are crossed. They'll continue to advance things. And I think just what Verb's vision was with saying, hey, here's digital surgery. We're not, just the navigation and imaging systems or the instruments or the robot. We're a connected platform with all of these apps and an open platform. The 5 of those things create digital surgery, influenced Intuitive Surgical, it influenced CMR, it influenced Medtronic to the benefit. And it became a methodology where now you hear where we were the first ones to use the term digital surgery. Now you hear people talking about digital surgery across orthopedics, across many, many other different areas as well.
Absolutely. That's a good segue. So, again, for the audience, I don't know who's listening to this who has not heard you, but just for context, you're a board member or executive chairman of numerous companies, just to name a few. Again, Hyperfine is one, Proximie, Acuitas, Invista, Wonder Medical, Volda, a lot of places. As a medtech executive, and more importantly, an investor and board member, 2022 is going to be very interesting because 2020 was just insane. It accelerated a lot of trends. 2021, there's a little bit of a correction in the market, but then I think a lot of people thought we're out, sort of out of the whole pandemic. We're really not. And so 2022 is really settling into what the market is going to unfold into. What are some things that you at least want to predict you think is going to happen this year, or maybe some things you're excited about?
Yeah, I don't know if it was Bill Gates or whatever said it's easy to predict what things are going to be in 10 years. It's much harder to predict what they're going to be in 1 or 2. So I think, and I don't, when I'm running these businesses or looking or working with the management teams to do that, I'm more focused on, hey, what's that vision? Like we talked about before, building the steps over the 5 years. So I think the trends that will continue are, smaller, cheaper, better, that are driven by technology. And so you look at 20 or 30 different technologies, whether it's with AI or robotics or sensors or connectivity, or you name it, that's going on across, whether it's genomics and proteomics and personalization. There's going to be these trends that continue to make things more accessible for the patient. So you don't have to go necessarily to a hospital. It can be done in your home, and you can be monitored there, and devices can be accessible to you there because it's a cheaper, faster, easier way to do things, and using the cloud and having connected platforms where AI can look at data. That also allows for this continuation of globalization that's occurred in MedTech over time, where, beginning of my career, everything was kind of US, some Europe. Now you're in all countries, but it's disproportionate. And, like I said earlier, with Verb, we're 7.5 billion people on Earth, only 1.5 billion people have access to surgery. That will continue to change by cheaper, faster solutions that use the internet, connectivity, and sensors, and the power of computing, which continues to, So I would be looking at, and if I'm having a business at scale like Envista with nearly $3 billion in revenue, how are we going to be disrupted by technology? How do we become digital dentistry? How do we make things more accessible, lower cost, better outcomes, democratized across the board? So, I always looked for analogies. So at Volcano it was, hey, how do we become Microsoft Office? How do we make Boston Scientific with IVUS? How do we make them Lotus 1-2-3? How do we, be the ones who have Microsoft Office with PowerPoint, Internet Explorer on an accessible platform? So similarly, at Envista or NuVasive or Hyperfine, how do we become, our 4.0 versions with digital capability, but not but being thoughtful about it, because I think it's easy to say, well, we need to go through this digital transformation, but to what end? What's the outcome from
exactly?
Not just doing it to do it, but again, back to what Chris
I agree.
What is your product being hired for? Therefore, how do I improve how that product's being hired to do its job?
Yeah, I completely agree. And something I wanted to highlight from what you said about, again, like what is a product being hired for? Something that sort of ended the year that really came out of the blue was Oracle. Of all the acquisitions that they made, Larry Ellison's largest acquisition of his entire career was $28 billion to buy Cerner, the EMR company. And so, we saw that happening. There was talks about Globus potentially acquiring NuVasive. And so there seems to be this merging of, traditional medical device with tech and software and everything, and more partnerships moving forward. Do you feel like the result of that is going to be that we start moving more away from, because you've mentioned cheaper, faster, better. Do you feel like med device, the future could be that we're moving away from and again, a lot of salespeople are gonna be pissed at us, is we're moving away from the old like razor blade model and really looking into these, SaaS and data like business platforms? Do you feel like that's sort of the move forward?
I think two things are going to happen for everybody, and that is connectivity of all of your devices, and then collection and activation of your data. So at Google, we adopted the words connect, collect, and activate. Connect all your devices, collect your data, activate your data. So if you're Cerner and you're Epic, those have been closed platforms which basically just recorded data, right? And they're not even connected in any meaningful, terrific way.
Yeah, definitely not.
They're kind of reimbursement platforms, and
that's right. They're made for billing, not for medicine, to be honest.
Right. So now, if you take, and same thing almost with a Salesforce, it took things to, if you're Oracle, like you let that happen by you, that should have been you that did Salesforce.
Yeah, really should have.
The people left there, Mark Beneff and those guys left and did it. Now you see what people like Viva are doing to activate Salesforce. And they've created a $40 billion market cap company where they're basically saying, hey, we can become the activation of Salesforce for pharma companies and medical device companies off of that platform. So, at Proximy, we're trying to connect all the platforms. At Wonder, we're trying to activate all the communications and the data in a different way. So I think, device companies per se, if I'm NuVasive, I'm Envista, I'm Acutus, where I'm at, you don't want to spend all this money developing Salesforce. You just go hire Salesforce. You just go, hire the SaaS solution that you
hire the product, right?
You hire the product for the problem. So Proximy, or Bright Insight with, internet and data, for all these different geographies to be HIPAA compliant and everything. There are these solutions that are device companies can implement. They don't have to do it or invent it themselves. They can use third parties, but they all are going to have to drive some level of connectivity. Some companies are way earlier. They've driven incredible solutions. You look at ResMed. I use ResMed's sleep apnea device. It's connected. I get my MyAir report on my phone every day. And I have continuous information. My physician gets summary reports of information. I good friends with John Sheridan, who's worked as our number 2 at Volcanoes, the CEO at Tandem. And you look at what they've done in the diabetes space, with a connected platform, FDA approvals for connected platforms using a Dexcom, sensor with their pumps and their systems. And now, the patient has all their information, the parent has the information. Those are good proxies for, what the future will likely hold. Back at Volcano, I wanted to connect all these IVUS images up and have people overread them, or way back at Digirad, when we had those nuclear images and we were having to record them on CDs and send them FedEx, and then you get your report back in a day. Today's model, that's being continuously uploaded during the case. AI's running on it, giving you your answer back. And that's what a company like HeartFlow, is doing as well. So I think you're going to see more connectivity. You're going to see more power of computing. You're going to see more activation of the data, not only at the episode of care, but over the continuum of care. And people are going to partner with third parties to help implement those solutions. Certain things, they're going to say, I need to own it and do it. And that's often going to be the specific AI around the implementation of their device. But other things they'll partner, whether it's with Amazon Web Services in a generic sense, or a Proximy or a Wonder, and those kind of companies are Bright Insight for the specificity of the totality of solution they're trying to deliver.
Got it. It makes a lot of sense, and I could completely agree. Now, Scott, I want to be mindful of your time. We're going to be coming up close to the hour, so we're ready to jump into rapid fire questions. Are you ready for it?
I'm ready. I hope.
Awesome. All right. So rules of engagement. You can take as long as you want to enter each of these. Again, I know you have a call top of the hour, so I'm going to end this with a couple minutes to go, so we have a few seconds to chat. So take as long as you want to answer, or as quickly as you want. You ready to go?
Ready.
All right, here we go. So first question, it's a softball question. All right. So during 2020 to 2021, we were all stuck at home. We bought a lot of stuff. We all Amazon Prime some things. What is the most interesting thing that you bought for under $200 from Amazon Prime? Could be a gadget, could be a book, anything that that you think of. What's the coolest thing you got?
The coolest thing I got? Wow. Maybe my thumper, which is sitting over there to the left of me.
A thumper? What is a thumper? I can't wait to see this.
This guy.
Oh, those things are great. I got one myself. It's awesome. Yes, for sore muscles.
There you go.
Absolutely.
With less travel and more working out and being 57, more need for a hypervolt.
Absolutely. Yeah, absolutely. I bought one myself. Selfishly, I got it because anytime my wife was like, can you give me a massage? I just get this thing. I turn it on. I can watch TV. I can do whatever. And I just, my wife is very happy with it. So yeah, great buy. Awesome. So next question. So we work in the world of medicine, and culturally medicine has a history of continuing education, right? You having been not having been, you're an entrepreneur, you're a board member, etc. There's so many people, so many founders you mentor. What book do you feel like you often gift and recommend most often to founders and medtech professionals?
Which book do I recommend the most? Well, I mentioned the 22 Immutable Laws of Marketing. That is definitely a book that I recommend. It's simple. It's a quick read because I think often, especially in medical devices, we're so focused on the technology or the clinical, but you need to be able to market your products. You need to create categories. You got to create stories. You started this whole podcast talking about the power of stories. And it's funny, I was listening to one of Malcolm Gladwell's podcasts yesterday, driving back from Joshua Tree, and again, it was just talking about the power of stories and how important they are to humans. So I also recommend just books, like whether it's a Steve Jobs autobiography, any of these stories of people who've overcome adversity and persevere. Any of those kind of books also, I think, create the motivation. And it's and when you see or read those kind of books that talk about specific companies and the cultural elements they developed and the rituals they developed, that then become stories, and you then can attach to them as you're trying to build your company or build your story and your success, whether it's personally or the company that you can relate to and then motivate you and excite you.
Absolutely. Love it. All right. Last question. And again, we got a couple minutes left. So thank you again for taking time out of your busy schedule to kind of kick off 2022 here on the show. I want you to pretend that for the next year, I take out a billboard, but I also take out, let's say, a notification on a phone, right? That every medtech entrepreneur is going to see. They're going to see this notification on their phone. They're going to see this billboard as they drive into work for the whole year, every single morning. What message do you put on that billboard and notification, and why?
Work hard, work harder. And the reason why is there are a lot of smart people. And I've been watching that show Yellowstone over the Christmas break, and these cowboyisms are a lot of that book. That historically, everything you needed to learn, you learn in kindergarten. And these cowboyisms are similar. It's work hard, work harder. Luck seems to find you when you do that. So, there's all these words and things about discipline and perseverance and grit, and they all center for me around just working hard. And I look for people who obviously have high levels of integrity, high intelligence, high emotional intelligence, but and experience. But the thing that I think differentiates the people the most is the will to win. And the will to win often comes from people who are willing to work hard. And there's no way around working hard.
I completely agree. Look, I mean, we're both on the same page for that. In my garage gym, I have a big flag, and it just says, "Nobody cares, work harder."
Yeah.
So Scott Huennekens, thank you so much for joining us. Everyone, this is the State of MedTech. I'm your host and head of state, Omar. Khateeb. We'll see you next time. Scott, stay on for a quick second. All right, everyone, I hope you enjoyed that. Now we're going to go into part 2, which is the bonus. This is Scott's keynote from LSI Emerging MedTech Summit 2021. It's called MedTech 3.0 and Creating Unicorns. If you're not listening to this on Spotify or YouTube, I recommend you do. You can see the video on both Spotify or YouTube. The reason why is that Scott has some fantastic slides that are worth checking out. If not, don't worry. Listen to this, go back, watch it later. It's a fantastic keynote. And if you've enjoyed this episode, if you love this podcast, help us out. We're climbing the rankings for the podcast, so we're trying to break into the top 10. If you're listening to this on Apple, give us 5 stars, write a review. If you're listening to this on Spotify, scroll up, give us 5 stars. We really appreciate it. Now, let's get to Scott's keynote at LSI 2021. And by the way, if you're a startup or a CEO raising money, I highly recommend you have to go to the LSI 2023. It's going to be at Dana Point this year. I'll be there. It's like the best show. I don't look forward to any conference in this industry, but this one I do look forward to. So go to lifesciencemarketresearch.com and sign up because the tickets and speaking slots go really fast. All right, let's get to his keynote.
It's my pleasure to bring to the stage Scott Huennekens. He is our keynote speaker this morning. Scott is chairman of Vita Flash Acquisitions, Acutus Medical, and Vista Holdings. I asked him for a bio, and he gave me a short description of what's important to him, and I loved it. He is, the things that are important to me, he's a father of 3, married 31 great years, and he's a hopeful grandfather of 10 or more. But it goes without saying, Scott's a successful entrepreneur, a CEO, board member. He's an investor in medtech with multiple IPOs and unicorns, and we're really looking forward to his talk today. Please welcome Scott.
All right, thank you very much, Scott, and feel very lucky to be here. And can you go back? I think I double-clicked there. So the goals for me this morning, hopefully they fit with yours as well, is hopefully some insights from my past. I feel so lucky to get to work in this industry. I've been in it for 30 plus years. I had great mentors like Mike Masalam, who I worked for at Edwards, and Ron Matricaria, who built St. Jude, and Bob Croce and the guys at J&J back in the day. And they all played it forward, and they were all available. So hopefully there's a little bit of playing it forward from some of my stories, some of the things that have been accomplished, and some insights to help motivate you as you go forward with your dreams relative to entrepreneurship and in this medtech area. And, I think we're at the most exciting time ever in life sciences and in medtech. And we really have an opportunity to leverage all of this technology that you've heard about last year, this year, relative to convergence and advancements to help democratize healthcare around the world. There's 7.5 billion people on Earth, and really, like surgery, only 2.5 billion people have access to it. How do we get after that as we move forward? And that's going to mean there's going to be a number of unicorns, and I'm going to prove they exist and hopefully help you guys create your own as we move forward here. All right, so 3 little topic areas, that we'll run through. Start with my dream and your dreams. And then we'll go into some of the stories relative to the companies I've been involved with, and then how I see things today which may relate to what you guys are doing to create this future. First of all, my dream, from a very early age was to be an entrepreneur. I wanted to build things. I wanted to be a part of teams. And again, privileged to work in this industry, but privileged to stand in this room with a bunch of other entrepreneurs who have that vision. And, it's not an easy job. It's a very, very hard job. And we'll talk about that. It's hard to be in startups, to disrupt big, large players. You guys are tackling that. I want to encourage you. I want you to leave more enthusiastic to do it than you came in the door. So we'll make this a little interactive. I'm going to ask you to do 2 things to start off. Why are you doing what you're doing?
You can either think about it real quick or write it down. Why are you doing what you're doing? Basically, what's your dream? Okay? And then what does success look like in 5 years for you, your company, what you're doing? All right? Take the time to do that. Why are you doing what you're doing? And then we're going to revisit this at the end, see if things change at all. All right, so number one, my dream. What was my dream? I told you, to be an entrepreneur. I think one of the most important things about being an entrepreneur is to face reality as it is. Face reality as it is. Ron Machikara used to always say, things are what they are, not what you want them to be. And so I'm going to talk a little bit about, my upbringing, and I think it was my first entrepreneurial venture, which was growing up in a rather challenging, difficult environment that required me to think about how I finance it to make the reality what I wanted it to be. So I was born in 1964. I do have a high optimist quotient. I was adopted and ended up with a single mom. My dad left when I was 5 years old. Both of them high school educations. No one had gone to college. My mom moved the day after she graduated from high school in Iowa to Southern California. My dad was a truck driver. He drove away in the truck, left her with 3 kids and 2 foster kids, and she had never worked in her mid-20s. That was the environment that I was in. So here's me, first day of school, in probably 1972. Other kids had brand new pants. I had brand new patches. You got to love the old, Sears Tough Skins. But I had this dream. I don't know if the dream as much was to get out of Riverside, which is where I grew up. You always be wary of places where they say, hey, you're an hour from the beach, you're an hour from skiing, you're an hour from Palm Springs. Yeah, but you're still in Riverside. And it's like where the smog goes to die in Southern California, back in the day. But, I had a dream to get out of there, to do something, to make a difference. You guys all have that dream. You're all doing things that involve making a difference. And continue that. So I used to go grocery shopping every week with my mom, not to help her grocery shopping. I would go into the aisle and read like Forbes magazine, Fortune. Couldn't afford a subscription, but I could sit there and read for an hour. And in reading it, this school kept coming up. All these guys who had gone to Harvard Business School, or gals, and companies they'd started and built them. And when I was 12, I ripped this one picture of the Harvard Business School out of Forbes and put it up in my bathroom. I said, I want to go there. I want to start companies. And with that step became, responsibility. You took that step to start a company. With that comes responsibility. And so with those dreams comes responsibility. Look, I grew up in an environment, it was Mother's Day on Sunday. My mom and I were going through, there were 23 kids on the 3 streets that we grew up on. 17 of them, time in prison, 2 that have gone to college. So when you look at this period of time, have you ever heard of the hero's journey? It's every Disney movie, right? There's a call to adventure, there's refusal, you overcome, enemies come, despair, then, gut check, climatic finish, hero at the end of the Disney movie. This is a lot what life is like, and this is a lot what entrepreneurs like. If you've worked at any company I've been involved in, you've heard the phrase, there are no bumps in the road, right, Jeff Mack? You're sitting there. There are no bumps in the road. That is the road. And this is the road to success. And you got to get through this. This is my brother. He's still in prison. Kidnapping, drugs, burglary, you name it. This is my sister. If you Google my name, I'm like the 3rd one that comes up. The criminals come up first. Sister, 20, on a drug farm, shot, there, a red underline, goes to prison, out of prison now, and doing pretty well. So it's a road less traveled, but these are obstacles. These are obstacles you face, that you're going to face in building your company. So at 16, I would leave school every day at 12, and I went to work at the Bank of America. I only got to play one sport. I wanted to play 3 sports. Nope, you're going to play one sport because you got to save money to pay for college. This is sacrifice. This is an entrepreneurship. I want to go home. I want to go do this. No, you got to sacrifice. It's a hard job in order to achieve these different things. The other interesting thing about working at the Bank of America is if you work there full time, they'll pay for half of your education. They didn't even know that. I kind of found it in the employee manual. And the other thing was, they would also give you 10% of any savings of ideas that you could come up with. So I was constantly trying to find ideas, in order to get financing. One was, I go to the UPS or the post office and they said, why aren't you sorting your mail? If you sort your mail into the zip codes, you can save 10%. Put that idea in, save this region like $200,000 for Bank of America. I got $20,000. So look for your financing in all these different crazy places, government funds. You guys are doing it, but there has to be some hustle there. I worked full-time at Bank of America my first 2 years of college. I went to school in the morning, on my lunch, and after work, had great people at Bank of America that let me do this, and ended up getting a full ride for my last 2 years to USC. I'm not telling you this to pat myself on the back. This is what entrepreneurship is. This is like, figuring things out, having to change, having to adapt. That's what's required for you. So the top might be your plan and what things look like. I don't know anyone, any VC who's in here probably will say, those are those graphs that go like this, right? And they never come to reality. They look more like below. And last year we were all in that boat during COVID. Now we're coming out of the other side of that as we move forward. So I eventually did get into Harvard Business School after they rejected me, of course, but I was used to rejection. My first driver's license, I was 5'5", weighed all of 105 pounds, bright red hair. For those who knew me 20 years ago, I had bright red hair, so I was used to a lot of rejection, being like that. But I also didn't take no for an answer and kept at it. Went and sat in their lobby to talk to the admissions officer, tell them they made a mistake, and then they gave me deferred admission so I could come the next year. Remember the lobby. So after Harvard Business School, now what? What do you do? So jumped into MedTech. I wanted to work on teams. I wanted to make a difference. I wanted psychic returns. 6 years I didn't go right into entrepreneurship. This is also part of this. You got to prepare for your success. So for me, that was, let's go see what great looks like. So, worked at Baxter, at Edwards. Mike Masalam was my first boss, hired me. I learned a lot during that week before he got promoted, and then I got a new boss, which was this guy, King Nelson, who a lot of you know, who's a fascinating, great guy. But I felt like after those 6 years, I was ready to go do a startup. But you guys, a lot of you have families, you've got other commitments. So I was ready to this last point, but are they ready? Is your family ready? And I talked to a lot of young entrepreneurs. Like, I shared my quarterly plans, the annual plans, with my wife. Thankfully, she's a tax attorney and the like, but I would force her to read them. Like, you have to know what I'm going through. We got to do this together as a team as you move forward. So, go, as a number of you know, that's what I say. I jump into this entrepreneurial intoxication period of time. And the company was called Digirad in San Diego. We were going to change the future of nuclear medicine. We're going to go from vacuum tube technology to solid state technology. This is an early kind of digital play, a lot of like the digital plays that are happening today, where technology creates entire new opportunities. We were going to create a whole new category, solid state versus vacuum tube nuclear cardiology. This would allow us to make it smaller. We could put it in a truck. We could move it around. We could have a different service model. We'd have higher image quality. All sounded great. We closed a $20 million financing, have a big article on us in Business Week. How much value is there in an article in Business Week? Makes you feel good. You can send it to your mom. She's proud of you. All that. There's no value, right? There's a lot more value in making sure the technology works, and our technology did not work. We had big problems with it, and again, this is kind of that next lesson. You heard last night on the panel, there was an asking about humility, and I thought that was a great answer relative to humility. As an entrepreneur, as a CEO, you've got to be willing to change. Change is the only constant. The goal here is success for the company, to create a solution for your customer. It's not to do the product you had the vision of. If the market says that's not right, if the technology says that's not right, if things evolve, you have to change. And so the reason you have to change is because when our technology didn't work, I tried to give the $20 million back to the VCs. VCs don't take money back. It's a one-way street. They will not take your money back at all. So we changed our platform, successfully developed it. We then signed an agreement with Johnson & Johnson because we basically can go from these vacuum tubes to solid state, portable cameras, but we could put that on a small transducer and we could do sentinel node detection for breast cancer with J&J. So, hey, I become the CEO. I was the COO, I became the CEO. My first son, Jared was born. I have 2 daughters than him. These are the 3 that I'm counting on for the 10 plus grandchildren. First week on the job, J&J terminates our agreement. We had hit every milestone. They had a strategy change. They terminated. My first week as CEO, I had to lay off 40% of the employees. I went home. I said, I am never working with J&J again. I got every J&J product out of the house. I threw it in the trash. No more Barbie Band-Aids. No more Little Mermaid shampoo. This is when I found out that as a family, we were not in this together. The kids were pissed. Caitlin and Lauren were not supportive of losing their J&J products. So anyway, we expanded. We changed and added the service business. Things were going really well, $40 million run rate. We filed to go public, and then September 11th happens. So here we are. I had achieved that dream, building a company, helping patients, $20 million of stock in current dollars, and then September 11th happened. So a lot of other people were way worse off, no problem, no doubt about that. But we have to pull our offering. I helped Digirad get through a Series G. That's where we were at that point in time. But basically, everyone lost everything they'd worked hard for because the market was frozen for 6 months. And I decided at this point in time, the juice wasn't worth the squeeze. And this is another thing. Like, you can work really hard. If the industry dynamics aren't there, if it's not going to meet your needs, sometimes you've got to just say, hey, it's time for someone else to take this over. Digirad went public 2 years later. I made $158 from my options. I said it was a nice dinner out, but I mean, how nice can a dinner be out for $158 when you got to pay a babysitter and the like? So you can imagine the wine was not so good. But that dinner still sticks in my mind, relative to all the lessons learned. Culture matters, team matters. The same team that did Digirad, most of that team went on to the next company, Volcano. You got to be flexible. You got to change. The investors made 3 to 4 times their money if they participated in that Series G. The company got public. I mean, for a company that had a technology problem that failed, raised more money to get through that, go to a service business, got public, they did okay. But this last point is important. Bad industry dynamics beat great management, cultures, and execution. So make sure you're in a market where, again, the juice is worth the squeeze, as John Onopchenko would always say to us as we looked at opportunities at Volcano. So moved on to Volcano after this. Much bigger market. Interventional cardiology is a huge market. Lots of things developing. Coronaries, peripheral, neuro, well-financed. We were very focused on vulnerable plaque, trying to understand the plaques that are likely to progress, cause heart attacks. At that point in time, ultrasound was this catheter that you'd stick in that had a black and white image that was very difficult to interpret. We were going to be the ones who colorized those images, tell you exactly what the plaque is. You could stent it before it ruptured, prevent all of these heart attacks. All right, so I joined in at the beginning of 2002. A lot of you have been to PCR in Paris in May. So I'll get there, and it was a double whammy. I brought Caitlin, I brought the 9-year-old at that time, my brother-in-law and his daughter, and we're gonna have a couple days of enjoyment. And we get off the plane, and this is what the weather's like. So if you're an adult, what do you see? You see, oh, it's just my luck. I say, my first trip to Paris, it's going to rain the whole time. It's going to be cloudy, right? But that's not what an entrepreneur sees. An entrepreneur say, oh, there are no bumps in the road. That is the road. You got to be the kid. These kids had the most fun that day, jumping in puddles, running around. They didn't even notice. So, as you're building these companies, you got to be the leadership for your companies. You got to be the kids jumping. We'll get through this. We'll get beyond it as we go forward. Next day, perfectly clear. My daughter still remembers this day because her cousin got to ride the elevator to the top, and I made my daughter walk all the way to the top. And I said, things that are worth doing are often hard. And so she still repeats the story about how she had to walk up, she saw all these views that her cousin didn't see, and she earned seeing the view from the top. And that's often what startups and building companies and achieving objectives are about. So it wasn't just a dark, rainy day. We also got our early clinical results from thermography, which was measuring the temperature. It didn't work at all. There had been some falsification of data by this one investigator on another company's product. But this virtual histology, this colorization stuff looks pretty good. Big deal. You got software. You don't even have an IVUS catheter or anything to put it with. This is, build a software and sell it. This is not a unicorn at this point. There's no way the software could be a unicorn. There were two IVUS companies, Boston and Jomed. So what do? We say, hey, let's go to Jim Tobin and let's see if he'll sell us his IVUS business. Of course, he's not going to sell their IVUS business, but we also knew that all of their IP had to be out-licensed when they bought SciMed, and it sat over at Philips. So keep that in mind. And then, fortuitously, January 8, 2003, the smartest guys in the room, do you remember Enron? Enron collapsed. Who collapsed with Enron? Arthur Andersen. Arthur Andersen audited Jomed. Jomed now needs to find a new auditor. The new auditor found problems. I read about it on January 8th on this newfangled thing called the internet. And I call Olaf Bergheim. I said, Olaf, this is our opportunity. He's like, what do you mean? I'm like, we're getting on a plane tomorrow and flying to Sweden. And we're going to wait in the lobby, like I waited in that Harvard Business School lobby, until the CEO meets with us. And we're going to buy their business because they have their bonds being called and da-da-da-da-da. So we sat there in the lobby for all day. He met us for breakfast the next morning. He told us who his chairman was, didn't tell us where his chairman lived. We found out from an investment banker that he lived in London. So after we met with him, we flew to London, knew where his address was, went to his house, saw that it was Mark Twain's old house. That was kind of cool. Then we went to the Starbucks on the corner, and it was out in Chelsea. And so then we call him, and he's like, well, I'm busy. I'm leaving to go to this dinner, and plus I'm way over here in Chelsea. Oh, that's odd. We're in Chelsea. We're at this Starbucks. Oh, that's only like 200 yards from my house. Oh, what a coincidence. So he has us over, and he only has an hour, but he's a Swedish shipbuilder. Olaf speaks Swedish. They talk Swedish shipbuilding for an hour, and finally he agrees to let us do due diligence over the next 2 weeks. And we end up reaching a deal with management to starve off their bankruptcy. And we would buy the IVUS business. Killed by the creditors. We then go and have to partner with Abbott because we couldn't buy the whole business. So we got Abbott to buy the interventional part. We would buy the IVUS pod. So we reached that deal, and it's fantastic, right? Now we have an IVUS catheter. We got the software. We're off and running. Not so fast. So we're at the airport, Vince Burgess and I, to fly up. We're being introduced as the new owners at the company, and we get a call for Rutger Schimmelpenninck, that trustee. And he says, Scott, sorry to let you know this, but Medtronic has come in with a higher bid, and we're going to take their bid. And, your 6 months of really being a great partner is over. We're selling the thing to Medtronic. I'm deflated. We go outside and we just sit down at the very first place that we can sit down, which happened to be in the smoking section. And a guy walks up and he picks up like 4 half smoked cigarettes, puts them in his mouth, and starts smoking them. And Vince Burgess turns to me and he goes, well, see, our day's not that bad. That really stuck with me. We just said, you know what? It's September 11th, 9/11 again. Shit happens, and it's going to happen to you. It's how do you react to those bumps in the road to overcome them. So, we were killed by the creditors. The deal went to Medtronic, but we still had the opportunity to go get the Philips technology. Philips didn't know they had it. We showed them that they had it. They were nice enough once we did that to also put it out to bid to Terumo. But we ended up winning that bid. We also then did the Medtronic Hail Mary. They were investors in Volcano. And we went to Bill Hawkins and said, look, we'll give you licenses to all this technology. We'll do all this stuff for you. And at the 11th hour, Father's Day, actually, of 2003, they pulled their offer, and we were able to win that asset. But again, making your own luck. The lessons here is it's less the story. The story is an example of what you're going to have to do to build companies. You have to make your own luck. So we acquired this. Be careful what you wish for, though. It's $40 million revenue business, losing $10 million a year, unaudited financials, and the like. So we proceeded over 3 years to progress forward with the technology, colorize it, expand globally. And this is another where something kind of transitioned, and it applies to today. One of my favorite marketing books is the 22 Immutable Laws of Marketing. And one of the lessons is if you can't be first in a category, create a new category. And so we created a whole new category. We weren't an IVUS company. We said, we're going to be a precision-guided therapy company. And this was a market that was $200 million, and we said, this can be a $2 billion market. And it involves FM with pressure and flow and image guidance and image co-registration and all these things. And we started marketing to Philips and the non-invasive companies and the invasive companies that this was its own category, and all three of them created the solution. We called it precision-guided therapy. Well, this not only created a category we could build in and win in and be defensible, but it also set up the tone of like, hey, Philips, your market's not growing over there. You can move over here, or Siemens, or hey, Boston's in IVUS, Abbott, Medtronic, you can move over here and build out your portfolio and your broader solution. So as you're building these unicorns, important to not only be in big TAMs, but also have 4 or 5 people that want to buy you. You know, at the end of the day, setting yourself up and thinking about who it is that's likely to acquire. Not that you have to sell, but that's just going to create friction and more potential value. So, I told you about my September 11th experience trying to go public. Almost died trying to take Volcano public. Very first day of the roadshow, flying into LAX, got on the backwash of a 767, upside down, straight at the earth. And I sat there and said, well, I didn't think, oh my God, I'm not going to see my 10 grandchildren. I went, oh my God, God really doesn't want me to take a company public. This is ridiculous. But we're able to get out and perform very well. Building out that category, so think about your company. What category are you in? What's your category? And then it was, hey, we want to change things, and we're paying attention to what's going on in tech, other business models. Pay attention to what's going on. We saw what Microsoft was doing. It was no longer, hey, Lotus 1-2-3 had a better spreadsheet than Excel. It didn't matter if Excel wasn't quite as good as Lotus 1-2-3. The product was not spreadsheets anymore. It was Microsoft Office. So Boston always had a little bit better rotational IVUS than we did. But the product was no longer rotational IVUS. The product was this one system, many solutions, an open platform, Covidian products, Medtronic products working on it, 23 apps, Boston closed platform, 2 apps, their ICE catheter and their IVUS catheter. We end up winning 80% of the installed base. Well, then you're going to win 80% of the disposables as you move forward. Are you a platform or are you an app? You're a company. In today's world, you kind of have to think in those terms. You may be a platform for this portion. You may be an app relative to how you interface with the rest of the ecosystem. I think it was Alan May last night was talking about, some of these things and how they're expanding, where you fit in this new digital world. Also, what is your optionality relative to expanding into other adjacencies and keeping those adjacencies open, which we did as we expanded across the body. So by December 14, we were up over $400 million in revenue, and we sold to Philips for over $1 billion. I didn't really want to sell at this time. I thought we were undervalued based upon where the market was and everything else. But we did it, and it's worked out very well. Philips is a great home for the technology. Today, that business is doing approximately $1 billion a year, still growing a little over 10%. So it would have a market cap of somewhere north of $6 billion. And most importantly is the top line. We drew our org charts upside down at Digirad, Volcano, where I'm at the bottom, patients and physicians on top. And that was always our focus. And now there's over 10 million patients that have had Volcano products. So that was unicorn number one. And it demonstrates all of these lessons, right, of the entrepreneur's journey and how you're going to see this. And that constantly repeats. And you just have to keep going. You get to that hero set, you go public. Now you go to this next stage where you go to the polycephalic phase, as we call them, multi-product, multi-geographies. And there's always new challenges. And you have to keep going as you move forward. So again, the main thing I take away here is just the TAM and be in a market with very good industry dynamics where you can be a leader in a category, a defensible position, which was also mentioned on that panel last night. Then, when you have the great team and the great culture, you can win as you go forward. So, now I've done that. Now what? Do I just become a board member, investor? And this ties into basically today and how I see things, and hopefully there's some benefits to that in this third phase. And so Renee and some of the people at J&J called and said, hey, we're looking to do this project with Google and J&J, develop a next generation robot. Went up and met with the Google folks, which was Google Life Sciences. They were still part of Google X. And this guy, Astra Teller, who's a brilliant individual, and Andy Conrad. And Astra had this kind of chart that said, Scott, over the next 10 plus years, we're going to see 10 times plus improvement in all of these technologies. I won't name them. Then there's 30 actually on their list, but just the main ones as it relates to us in MedTech listed here. They're going to be faster, cheaper, smaller, become ubiquitous. You can build them in your products. You can create new platforms. And at Google, they would say, hey, that leads to this opportunity to create these moonshots. You've got these technology breakthroughs that are now scalable and affordable. So now these big problems, 7.5 billion people, 2.5 billion people have access to surgery, that's a big problem. Or, driverless cars or internet access for 7.5 billion people. Now we can have radical solutions. So are you thinking big enough about the technologies, the problem, and what you can solve? And then you look at what's happening in Silicon Valley and what's happened over the last 10 years. There are over 50 companies just in that valley, and you feel an energy when you get off the plane, right, in San Jose, that have over $10 billion valuations. We're talking about decacorns, not unicorns. And so many of them are built around this last premise. The most valuable companies have staked their futures on digital platforms with interrelated, interdependent products and services. I don't care if it's Amazon's not there, but Google, Facebook, Uber, Airbnb, Netflix, you get the idea. Spotify, Pandora, all these spaces completely disrupted by platforms with apps. So again, how do you fit in an ecosystem? Are you a platform? Are you an app? How can you develop so you have more control of the platform, to have more of the data? These are the kinds of things that are creating tremendous value. They are also at that time not being applied really into medtech and life sciences. So you saw these things where the IT department used to be in the corner. Now, all of this information and capabilities at your fingertips, all your data can be in the cloud. Books were in libraries. Now all the information in the world's available at your fingertips. Cars were done unconnected things. Now they're connected smart objects. How do we apply that in medtech? So it's something we kind of coined as MedTech 3.0 or Life Sciences 3.0, where in the past, at the beginning of my career, you'd make an oxygenator, you'd make a catheter. That was it. That's only the beginning today. It's the product plus the connectivity, the data, and the activation of that data in a particular platform or as some kind of app. You got to think broader about how you do that. That may mean you have to partner with someone to connect. That may partner with someone relative to the data, but how do you create bigger solutions? So you're not Lotus 123, right? You're Microsoft Office. You're a Google suite. You're an Amazon suite of products, and your solution gets bigger and more protected. So joined up to do Verb Surgical with Google and J&J. Again, we knew we weren't going to beat Intuitive in what I call Surgery 3.0, which is robotic surgery. We had to create a whole new category. So that was Surgery 4.0. digital surgery, working with Verily, and just seeing what they were committed to. Verily, Google Life Sciences got renamed to Verily. The mission is, make the world's health information useful to everyone. Google's was to make all information. They were more specific. And they had this mantra around collect, organize, activate. And I think you should be thinking about that relative to your business. For me, it was, I like connect, collect, activate. But either way, collect, organize, activate. How are you doing that in your business? How are your competitors doing that? How do you stay relevant relative to that? And then why? Well, why are you doing this? Well, be competitive. But, for us, it was 5 billion people who don't have access to surgery. It was all these surgeries that were needed. It was all these deaths that were preventable. And then on the 2.5 billion people who have access to surgery, the quality is so variable. How do we improve the quality of those? All these things now become possible given where technology kind of is. And we did that in a platform kind of way. So how's a platform, again, apply to you? It's not just for minimally invasive surgery. We can start using robots and data in open surgery or hybrid procedures. Now we can think about the solutions in an entirely different way. But again, just like on those Silicon Valley interrelated synergies of a Netflix or an Amazon or a Google, how do we get synergistic platform effects by having robotics, enhanced visualization and image guidance, instruments, connectivity, data analytics, and machine learning? How do we do that in an open platform like Apple, where there's no Airbnb and Uber and all these things without an open platform on Android or on an Apple? So we said, hey, we've got to connect to the cloud. We've got to connect to the PACS and make all that economic information available. We got to have service portals to update our software. We got to collect data to improve surgery, then have system updates. And we have to have a surgeon portal. The surgeon needs quality metrics. The surgeon needs information. We knew we weren't going to, 57 different procedures, we're not going to come up with all the apps to improve each of those procedures. But if we had an open platform, then you have companies like CSATs, you have other OSI, which we ended up buying a couple of these, but partner with people to be on your platform to make it all go to the next level. And then you hear a lot about autonomous driving, autonomous surgery. I believe all those things are possible, but I think they're 10 plus years out. We were focusing, and a lot of the companies I work with today, we're focused on the first two levels, which is actionable information and semi-autonomous information. What do I mean by that? Easy to apply it to driving. So in a driving, actionable information is GPS. GPS doesn't drive the car, but I can enter the information. I know where the traffic is. I can go around it. I can do things the best way because I have that information. I have a rear view camera. I have sensors. This gets you 70, 80% of the way there to improving quality without the hurdles of regulatory, without the hurdles of which are much higher for autonomous. Then semi-autonomous is parallel parking. So this might be suturing. This might be some simple, straightforward steps that are definable to do that can take out a lot of variability out of procedure. I like to think about it like manufacturing. Do a Pareto. Where's 80% of your variability? It's usually 20% of the processes. How do I automate those? How do I standardize? How do I improve those? So how do those things apply to your technology and your company to improve your quality? So Verb ended up being bought by J&J and is progressing forward in combination with Auris and their whole soft tissue robots, flexible robots within the J&J mantra. So what's next? What are kind of some of my final thoughts for you? As I started thinking, this is the most exciting time ever in life sciences and medtech. Back to Asher Teller's 10 times slide. All of the stuff that's going on in other industries is creating the opportunity to use their technologies at scale, cheaper, better, faster, smaller. How are you going to apply those to create this medtech life sciences 3.0 world? Are you a platform? Are you an app? Are you both? How do you fit in with those? And I'll talk about horizontal and vertical views there. How do I then open up new opportunities to improve things for the 2.5 billion, but go after the 5 billion that weren't accessible before? We as an industry, we're making things that are super expensive that only apply to the US, Western Europe, Japan, then trickled out into other places. there are going to be lower cost suppliers that are going to start going after those 5 billion in different ways. Those are huge, huge opportunities. And I think, more unicorns mean more patients that will be affected positively. So I think of things across the continuum of care, this horizontal on one metric, which is to say, we're going to start monitoring people for different conditions. We're going to get earlier indications. That'll lead to further diagnostics, earlier interventions of therapies. Then you're going to have hospital therapies. Then you're going to monitor people after that. And then you're going to have things come back around. It's kind of that mantra of plan, do, check, adjust. And so if you think about, an Apple Watch, monitoring for arrhythmias, then you get some early indications, you have additional diagnostics, you got eye rhythm, Holter monitors. Now you go into, an EP lab, you get treated for AFib with more connected devices. Then you have monitoring and you come back around. You look at diabetes with sensors and full systems and plugged into your phone where the doctor's getting information and you're getting information about your kid. All these things become possible. That's across the horizontal. Then vertical connectivity. You go into an OR, you go into a lot of episodes of care. None of these devices talk to each other. So it limits the learning that can come between them. So I'm involved with company Proximity. There's others like InTouch, Avail, Care Syntax that are trying to connect things vertically. And then people like Bright Insight with clouds for the med device industry. How do you connect those so you have an operating system so these things can communicate better? You can learn better together. So the companies that I'm working with often have this kind of platform effect. Acutus is an EP where we went public in the middle of the pandemic last summer, building out a portfolio of products that are trying to connect things vertically. And it's an open platform to work with St. Jude, now Abbott's catheters, or work with Medtronic's cryo products to provide better mapping, better tools as you go forward. So my 4 public companies, NuVasive, we're looking at digital spine surgery. It's spine 3.0. What do we have all of these elements, robots, visualization, advanced instruments, connectivity. When I joined, the stock price was about 40. Today, it's 70. Part of that is we've announced our robotics program, our navigation program with Pulse. Envista, we went public right at the end of 2019, at like 17, we're 45. Today, digital dentistry they're $3 billion in revenue, is a big part of that message. Navigation, different imaging, connected platforms. Now if you're NuVasive, there's all these kind of like ankle biter people with implants, but again, we're trying to make them Lotus 1, 2, 3, right? Because they're not going to be able to provide the full solution. So how do they then work with us? We become the platform, just the way Apple charges a toll for access on their phone. This then leads me into, hey, there's so many of these opportunities. It's such an incredible time. Let's do a SPAC to try and be more involved in creating more of these unicorns. So I'm also involved in, on the boards of 4 private companies, plus doing the SPAC, and the objective here is, unicorns 3, 4, and 5, and help a lot of patients as we move forward. So hopefully you see through these a lot of themes as you go forward relative to this entrepreneur's journey that you guys are all on. You're motivated to get through and lead through these challenges as you go forward. So to wrap things up, back to where we started, looking at, why are you here? Why are you doing what you're doing? I challenge you to, as you walk out, is that big enough? Is your dream big enough? Is it right? Do I need to adjust? Do I need to adapt? How do I commit to looking at competitive dynamics, technology dynamics, platforms, et cetera, in order to drive that success over the next 5 years? So thank you guys. Really appreciate it and wish you all, the best of success. I don't know if we have any time for questions, but.
Who's up? Somebody's got to have a question.
Yeah, go ahead. I can repeat it.
Thank you. Hey, Scott, thank you very much for the wonderful presentation. So, one of the themes that kind of stood out is this concept of not only testing, but a lot of learning along the way. And I'm sure along the way you had, quite a lot of mentors, people who helped you out. When you think back on the people who advised you and guided you, what was the most memorable, painful thing that a mentor or someone told you, and how did that, change you in terms of a leader and entrepreneur?
Yeah, look, I started my first job was at Berkshire Medical Systems. It was the very beginning of minimally invasive surgery and lap choles. I had to leave after 2 years there because I was just a pain in the ass. It was like, and I had a really good boss there, a great boss there, a guy named Bill Maya, and he's just like, you're too hard on people. No one's gonna ever meet your standard. Nothing's ever good enough. Like, you've got to, and that helped me flip that graph of patients and physicians on top. I work for you. How do we work as a team? High, expectations, but not be, such a challenging boss that nobody wanted to work for. Everybody wanted to work for John Rooney, the product manager. All the RA, QA, and clinical people were getting all his projects done on time. He was leaving them lollipops, taking them out for drinks, doing all these. I'm like, why do I have to do any of that stuff? Like, just do your job. Work till 10 o'clock, get it done if you have to. I'm flying across the country because I want to meet my budget and sleeping on the floor in the airport at 5 a.m. When I land, this is what you do, and no, that's not, you may do that. Like at Volcano, Jeff was, our number 2 under our CFO, and he can attest, like, always only flew Southwest, never, flew first class, always rented the cheapest, car with, like, this one has electric windows. I want the one with the roll down. Like, but it was like, part of it was that some of the lessons learned from these great leaders I saw that had that servant management style, which was, I'm running through walls and breaking things and pissing everybody off. So that wasn't scalable. And thankfully I learned that pretty early. But I still have to fight that because I'm impatient. I want to go, and you got to make sure to bring people along. Your family, your teams, your investors, your board, et cetera.
We got time for a couple more. Anybody? We don't need the mic. Small room. Somebody's got a question.
Yes, Lisa.
So what new technologies that you are on your radar that you're super excited about, or new startups that you're seeing?
Yeah, I'm excited anytime where you can make something smaller, faster, better, that opens up more people being able to use it. So now with the SPAC, I was telling Lisa the other day, it's like, I've probably been in 65 presentations to us, in the last, month and a half. It's like 2 TED Talks a day. It's fascinating. So I think that's one category. The brain is a huge category. I think it reminds me of where the heart was 25 years ago, where when Ken Charhat's back there, when we started at Edwards, there was like one market that was $1 billion, and that was bypass surgery. And you knew there were going to be all of these other markets that evolved, and you see that in the brain. So all this neurostim stuff, all hyperfine, with portable MRI and making it accessible to all these people, like relative to stroke, and all the different neuro companies, and learning about the functionalities of the brain monitor. We don't have vital signs, for the brain. There will be vital signs for the brain, in the next 10 years. We were, talking last night about, different areas, whether it's monitoring, whether it's, just monitoring the patient and their action and tests and the combination of things. So those are areas that I find very, very interesting as well. But I do think this how do we make things with data and like, no one would have guessed, we'd have all of these cell phones and 6-7 billion of them with everybody having one in the palm of their hand around the world, 15 years ago. So how do we dare to dream to say, hey, is it 5 billion people who have access to a certain level of care? And we're now some of the technologies to accomplish that. Yes?
So why do you do what you're doing right now? In other words, what's your motivation?
Yeah, my biggest motivation is just making a difference. Relative to that vision of of the 7.5 billion people and 2.5 and improving care. So that's what gets me excited every day, and to help. And I love helping other people achieve, their dreams. I mean, I've had 22 people who've worked for me now that are CEOs, and so investing in those people who, when they come to work for me, I say, hey, if you want to leave in 2 years, I want to help you achieve your dreams. So then creating that leverage, because that ties into the goal. So if I'm helping these 5 people, it's that 7, then it creates that leverage. That's something I learned back to Omar's question relative to Tim Walliger. Tim Walliger worked at Hypertech in San Diego. There was no medical device industry in San Diego. Everything kind of blossomed off of Hypertech. And then Tim, did all these things like Biosite and Digirad, and then Digirad becomes Volcano, and now there's 6 or 7 other startups in San Diego off of Volcano. So I love being a part of that and creating that effect for people and for patients. Yeah.
How does the next 20 years of business models look like versus the last 20 years? So as you mentioned, there's AI, big data, high performance computing, cloud technology. With all this convergence, we're going to find and unlock more potential, more understanding of the preventative methods, early diagnostics. So I just want to hear how does the business model look like? It's going to be quite different from the last one.
Yeah, I completely agree. I mean, MedTech, like I said, MedTech 1.0 was make that catheter or make that oxygenator. 2.0 was now we have computing power and microelectronics, and we can do things differently now. We've got that, plus we have connectivity and all of these other things. So I would say I don't know. And I mean that in a positive sense relative to, I didn't know where Volcano was going to go. I didn't know where Digirad was going to go, but I want to listen, where Verb was going to go, or any of these companies. Listen to the market, listen to things, try and find analogs in other industries on how you develop a model that creates value that's defensible. So that you're not just doing something because it sounds good, but it's not, there's no exit. There's not 4 or 5 people that want to buy it. There's not, it can, like Clubhouse today. Everyone's all excited about Clubhouse. I was thinking, like, how does this work? Because Facebook could add that in a month. LinkedIn could add that in a month. So how do you, not get disintermediated, when you're, selling 90% of your products through Amazon, and then they just start selling direct in an unbranded product? I don't know. Like, these are things you gotta think about what, is likely to transpire as you move forward. I know that doesn't answer your question, but that's the world we're looking in. So then, just like I looked at what Microsoft Office did to Lotus 1-2-3 and said, let's do that to Boston Scientific, which we did effectively. I would say look to these other models about how you can do similar business models that can work, applying those technologies in your particular space. Alan.
How do you see costs coming out of the system? We're pumping all this technology in, and the big companies love selling expensive ticket items, so they want to keep doing that, and we can't afford the system, and we have to push costs out. How do you see that happening? What are things we can do to help that?
Yeah, I think that's this room, right? I mean, stasis is the preference for large companies. We're their R&D departments to innovate and disrupt them, to force them to have. When does biology change? When it has to. Like you learned that again this last 15 months. Like we adapted and we changed, and so I think. Like if you take Hyperfine, portable MRI. Now portable MRI can be 1/10 the cost of MRI in the suite. That makes it more accessible. It also frees up, these kind of procedures can be done on that. Now you have more capacity over here for the high cost part, but overall your costs go down. You look back at, and I think diagnostics and guidance, so like us back at Volcano, FFR would tell you that half of the stents that were getting put in were unnecessary. So our market share at Kaiser, 50%, our market share at HCA, 5%. So, but that changes, over time as people say, hey, we need to treat the right patients the right way. And that's where data and all this connectivity is going to help. In the world of, Verb, what our vision was, the visions of like Avail, Proximity, these other guys is, let's start understanding, surgery better. It's it's very much an art today. How do we make it more like, a manufacturing floor where you should use these steps, these tools, you'll have less blood loss, you have faster recoveries. Those are some examples that I can give you. But also, look, the camera technology is advancing on these iPhones, and now you can have a disposable endoscope instead of having, one that has to get refurbished and sterilized and everything else. So now, I see a future where there's probably $100 disposable endoscopes that have high quality imaging. So taking those technologies and bringing them over and leveraging them, I think is critical. Now, that's the cost going down. Will the price go down? That takes other people pushing.
Thank you for listening to another episode of The State of MedTech. I'm your host, Omar Khateeb. Do us a favor, if you like this episode, share with somebody, and go ahead on Apple and Spotify, wherever you are, leave a 5-star review, type a few nice notes about us. This is how we get other people to find the show. Thank you, and we'll see you next time.